Thanks for watching the Medical Class 901 with Dr. Chi MD, an infectious disease specialist and professor of medicine in Memphis, Tennessee.
Let's go.
Welcome to Medical Class 901 with Dr. Chi. I am Dr. Chinelo Animalu, infectious disease and HIV specialist and also a professor of medicine in Memphis, Tennessee. So, all right, guys, we're going to talk about HIV. You guys know that all I do is talk about HIV as well as other sexually transmitted infections and other communicable diseases. But something came to my knowledge recently. So I am originally from Nigeria, Anambra State, in the southeastern part of Nigeria to be exact. And as you all know, I am very passionate about HIV/AIDS, especially here in Memphis, Tennessee, because this is my home. This has been my home for more than a decade. And Memphis, as we know, ranked number 2 with the newest cases of diagnosis of HIV in the United States back in 2025. And what was really concerning about this is the fact that it was affecting our kids, the younger generations from the ages of 15 to 23 years old. And so, you know, we're talking about high school and college kids. As a mom, it was like, I was traumatized, like hearing about that. Oh my God, what are we doing wrong? Because clearly there's something that we are not doing. So recently I went back to Nigeria to visit family, and I went to my state of Anambra, where I found out that we also back there are plagued by HIV. Anambra State has one of the highest cases of HIV in the country, in Nigeria. So of course, for me as an infectious disease and HIV specialist, you can imagine how I felt. So one thing I want to talk about now is, you know, again, lack of education. You know, I always say, you know, from the Bible that where, you know, it says my people perish, you know, because of lack of knowledge. And you find out that one thing that is a problem is undiagnosis, like when people do not even know they have HIV. You guys, you have to go back to my channels in YouTube and look at other videos that I've done about how HIV presents, how you would know whether you have HIV or not. So I'm not really going to spend much time talking about that right now. But the main thing would be, do you have HIV or not? How would you know? The only way you would know is to get tested. And so I'm saying this not just for Memphis or the, you know, southern United States or the entire United States. I'm also talking about countries in Africa. I'm talking about Nigeria, which is my, you know, country of origin, as well as other African countries, because this is something that is killing our young, you know, our young kids and, you know, the younger generations. So we've talked about that, you know, get tested. And something that I really want everyone to know is that HIV is no longer a death sentence. In the 1980s, people that had HIV were just expected to die. But where we are right now through, you know, advancements in technologies and pharmaceuticals, where we now have medications that when you take, then you're able to control the HIV and you can live your normal life. I tell my patients that this is just like somebody that has hypertension, diabetes, asthma, high cholesterol, you know, what we call chronic illnesses, where you just take your medicines and you're doing well. And so that's the same thing that also happens to, you know, in the case of HIV, you get diagnosed, you take your medicines, and you will live a normal life and you will not be able to transmit this to other people. So, you know, when I was back home, you know, like I said, in Nigeria, in Anambra State recently, and, you know, I found out, you know, talking to people that, you know, they say, you know, how about if I don't know I have HIV? I said, that's where the problem is, because you may be having, you know, sexual intercourses with people without you actually being aware that you are passing this deadly disease to other people. And what happens is that those people also will pass it to other people, so it gets propagated around the communities. And then what happens when, you know, we hear that somebody has HIV HIV, everybody freaks out. Like, okay, stop, stop, stop. Like, and then the stigma comes in, right? People are like, oh my God, you can't touch me. I can't share utensils. You can't kiss me. You can't be around me. And that's terrible, right? But this comes from the fact that people do not know any better. So part of my job as an infectious disease doctor and HIV doctor would be to let people know that no, you do not get HIV by shaking hands with somebody. You do not get HIV by kissing somebody, by sharing utensils, or silverware with people. You don't get HIV by sitting next to somebody that has that. And so this is something that we as a community, especially the minority communities, we need to work on. How not to stigmatize people living with HIV. That these are our brothers, these are our sisters, our children, our uncles, our dads, okay? So you can't do that. But again, I don't think it's something that people are doing consciously. There's something in the field of medicine, there's something that's called unconscious bias, when you're biased, but you don't even realize that you're biased. All right. So let's say somebody now is HIV positive. What happens? You get on your medications and you're good to go. Where the problem is when you stop taking your medicines or you refuse to take your medicines. According to the Center for Disease Control here in the United States, as we all know, it said U is equals to U. What it means is that undetectable is equals to untransmissible. What it means is that when you have that infection under control, even if you're having sexual relationships with other people unprotected, meaning without condoms, be it male condoms or female condoms, you still will not be able to pass it over to somebody else. So the main thing for HIV is to get people tested. If you're negative, good to go. Then try and stay negative by practicing very safe sexual methods, barrier methods, using condoms. If you're with somebody that has sores, that has genital wounds or whatever, you try to avoid that, okay? Just taking measures, preventive measures. Now, if you are positive, what happens? Stop. Nothing. You got to take your medicines, okay? You have to find, be it a health center, the hospital, clinic, somewhere. You got to have yourself plugged in somewhere where the doctors who treat this infection can put you on the right medicine. And as long as you're taking your medicine, 9 out of 10 times, you are good to go. Where the problem comes is if you're not taking your medicine. HIV will kill you if you don't have it under control. And the only way to get it under control is taking your medicine. We call it compliance. When we say that you are being compliant or somebody's being non-compliant, meaning you're not taking your medicines. And so just for the sake of humanity, I see on social media, I see, people saying, hey, I got this infection from somebody, so I'm going to spread it around. That is really, really wrong and something that, bothers me down to my soul. Why would you want to do that? So I'm just, talking to everyone. We all have to work together in our communities. We have to support our brothers and sisters that have HIV. We have to get tested, every single one of us. It's something, I know when I tell some people, hey, have you been tested for HIV? They're like, oh Lord, no. I mean, it's scary, right? But it's something that you gotta do. So, and then for people who are very high risk, it could be, healthcare professionals like us from needle stick injuries. If you're practicing, some sexual practices, for instance, you have multiple sexual partners where you're not using protection, or you are trading sex for things, or you use intravenous drugs. That's when we talk about IV drug users, or you're sharing needles with people. These are all risk factors for contracting HIV.
Let's talk about Black men and HIV. The Centers for Disease Control and Prevention, CDC, projects that 1 of every 3 Black men who have sex with men will get HIV in their lifetime. There are many intersecting reasons for this disparity, including poverty, stigma, unequal access to healthcare, and a general distrust of public health. In efforts to stem the disproportionately high rates of HIV, public health officials are increasing community outreach to promote confidential HIV testing and provide preventative tools for the Shelby County community. Tune in to Medical Class 901 with Dr. Chinelo Animalu, MD, for more educational information regarding awareness, prevention, and treatment options for HIV. Thank you, and please get tested.
So as you know, infectious disease is a specialty that basically deals with managing or treating various types of infections. It could be bacterial, it could be viruses, it could be fungal. So another disease to consider would be syphilis.
It's back, or has it never went away?
So we thought we were on the path to complete eradication, but it's done a rapid turnaround, so we are back to syphilis areas. Syphilis, just like HIV, would be, considered a sexually transmitted infection, and it was rampant, in those days. And there was a lot of effort by the government, the CDC, the World Health Organization, UNICEF. People came to, do everything possible to have this infection eradicated, but it's made a major comeback. And we are seeing this amongst our younger generation. And as a parent, I have kids in college, I have kids in high school, and that's the age range that is worse right now. And also, when you talk about race, it's worse in the African American communities. So it's something that's very passionate, to me. And I feel like part of what we're seeing is lack of education. I took the liberty of talking to a few high school kids, and I just kind of wanted to see what they knew about HIV. I say, what do you do? And they were like, you take antibiotics. And I almost passed out. No, man, you cannot take antibiotics. It's a virus, not a bacterial. So it became very clear to me that our communities are not well informed, well educated, and I feel it's part of what we do to kind of steer them in the right direction. I am Dr. Chinelo Animalu, Infectious Disease and HIV Specialist and a Professor of Medicine at UT College of Medicine here in Memphis. So this is a show where we discuss different and various types of infectious diseases and infection. And in prior episodes, we've talked so much about HIV because this is something that is becoming so rampant in our country. So today our show is going to focus mainly on prevention, and we're going to talk about PrEP and PEP. These are things that are very common in the HIV world. Another important thing I would like to say, especially for Africa, would be what we call vertical transmission. And this is when a pregnant woman transmits this infection to her unborn baby. So it's something I will want us to, address and talk about later. Okay, so here in the United States, pregnant women usually who show up for antenatal care get tested for HIV. If you're negative, that's good to go. If you're positive, then the doctors are able to put you on HIV medicine that would help control that infection. So when you give birth to your baby, you don't transmit that infection to the baby. Now, for women who may not have had routine antenatal care, then that becomes something different. Okay, so let's talk about what we will see in places like Africa, where maybe the average woman might not have access to routine antenatal care. If during birth or after birth, immediately after birth, we find out that the woman is HIV positive, then you have to put that baby on antiretroviral medicines to try to prevent that child or that baby from picking up this infection. So that's something that we will talk about later. And also I do have videos where I have discussed this previously. So, you can check it out on my YouTube channel, Medical Class 901 with Dr. Chi. So thank you all for tuning in today. And if you want to, hear more videos, see more videos, hear more talks on HIV, as well as gonorrhea, chlamydia, herpes, every single STD you can think about. So click on that, on the link below, or you can scan my QR code and it will take you to my several social media platforms, Facebook, YouTube, Instagram, and everything. So we will see you guys next time. This is Dr. Chi, Medical Class 901 with Dr. Chi.
What is HIV? HIV, human immunodeficiency virus, is a virus that attacks the body's immune system. Without treatment, it can lead to AIDS, acquired immunodeficiency syndrome. There is currently no effective cure. Once people get HIV, they have it for life. But proper medical care can control the virus. People with HIV who get on and stay on HIV effective treatment can live long, healthy lives and protect their partners. Some people have no symptoms at all. The only way to know if you have HIV is to get tested.
Hey guys, so we are back from commercial break. So some of the questions, common questions I do get would be, I talk about use of barriers during sexual intercourse a lot to prevent infections, STIs, sexually transmitted infections. But one of the questions I got would be, okay, so if you're using condoms, does that protect you from all STIs? So I just thought it was something to kind of, put it out there and, also educate people. So the answer is no. So there are certain types of infections that you can get even though, your partner, I'm talking about females now, even though your partner was, using a condom, or even you as a woman, you were using female condoms. So let's talk about things like HPV, right? The human papillomavirus, that is the main cause of cervical cancer that we see a lot in women. And this has nothing to do with, whether at any particular point in time somebody was using condoms or other forms of barrier methods. So HPV is an infection, from the virus, human papillomavirus, that you can actually pass around with or without, the use of condoms, which is why in places like here in the United States, women, we encourage people to get the pap smear done, because that's the fastest way to diagnose cervical cancer. Then things like herpes, okay? When we talk about herpes, is something that is so common. The question becomes, who hasn't had herpes? Not, do you have herpes? Okay, so herpes is something, it does form ulcers. It could be in the mouth, it could be in the genital region. So for most people, there are two basic types, the HSV1, the herpes simplex virus 1, and then the HSV2. The 1 is usually what will cause cold sores. So you can see it in even children, right? Young adults, and they say, hey, I have a cold sore, and that will be HSV1. Then HSV2 is the genital one, the one that kind of occurs in the genital area. And also one would like you guys to know that HSV1 also can occur in the genital area. And what happens is that you have ulcers around the, for the woman, it could be around the cervix, it could be in the vagina, it could be, outside that area, it could be in the, anal region for people that have anal sex and stuff like that. So it doesn't necessarily, is related to the use of condoms. So if you have lesions, or your partner has these herpetic lesions in areas around these, let's say in the cervix, or let's say in the rectal area or the anal areas, or even in the mouth, right, during oral sex. So no amount of condom is going to protect you then. So yes, so this will be one of those kind of infections that you can get even though you had used condoms. Another thing to consider would be lice, right? pubic lice. So I know some people are going to be like, ew, what's that? Oh my God. Like, no, it's not something you get because you were dirty. It's something that lice, just like the head lice that we see in children, in school age children, or whatever, it kind of lives in the human, in the hair, right? And so the areas where you have the pubic hairs, you can have lice hiding around somewhere in the corner there. And so, during intimacy, you don't necessarily, have to have sexual intercourse with somebody. It could just be during, periods of intimacy, lying next to each other, but you have some contacts between, that genital area. The lice could move from that person to you. So again, this would be one of those things that it does not matter if you were using any barrier protection or not. It could actually, you could contract that. So, but again, the emphasis will always be on preventive measures. So if if you were trying to be intimate with somebody, it could be male, female, it doesn't matter, and you notice that they have lesions, okay? It could be warts, genital warts. Some people have lots of genital warts. You see things that are not normal, right? They're ulcers. It could be dry, meaning that it's not draining fluid. It could be ulcers that are draining fluids. It doesn't matter, but you can tell that something is not right here. It's always better to, if possible, not to engage in any sexual activities at that time, because you have a very, very high chance of contracting whatever infection that person has. So a person would be like, okay, so what happens if, somehow it still happened? What do you do? Find out, go to your doctor so you get tested, and, they can treat you for whatever it is that you contracted. Sometimes it could be something bacterial, sometimes it could be something viral, and sometimes it could be something fungal. In recent times, there's been, cases of fungal infections that's been passed on, from one genital area to another. So the only way for you to know, unless your partner knows exactly what they have, and then, you can go to your doctor or go to any health center and say, hey, I think I have herpes, and then they'll be able to put you on some medicine for herpes. Or you say, hey, I think I have, pubic lice or whatever, and then they'll be able to put you on medicine for that. But in cases where you don't know, please go to your nearest, doctor or health center or clinic or whatever, and then they can test you and see what you have and be able to treat you for it. So I think my message here would be, for people to know that yes, use of barrier methods will protect you from, things like HIV, from, things like hepatitis, chlamydia, gonorrhea, but then you also have other types of infections that, kind of affect the skin. So not something deep, but, around the skin area, around that, the cervix, other infections that you can actually get regardless of, use of barrier methods like condoms or not. So you guys let me know if you have any more questions, or if you would like me to clarify on some other types of infection. I mean, there is so much infection. It's not something I can, talk about just one time. So just let me know if you guys have questions about treatments or the best way to reach out to doctors. It doesn't have to be an infectious disease specialist, because they are a rare breed. Usually cases that come to us are very complicated and difficult cases, but we have our colleagues, other doctors, your primary care doctors, we have our NP colleagues as nurse practitioners, ER doctors. We have other physicians that are able to come in and help. But the main thing is, having that knowledge. Knowledge is power. And also, being aware of what you're doing, who you're doing it with, and how you're doing it. Welcome to Medical Class 901 with Dr. Chi. I am Dr. Chinelo Animalu, Infectious Disease and HIV Specialist and a Professor of Medicine. So we have been talking about HIV, the effects in our communities here in Memphis, as well as all over the United States and the world. But there are other infections that are also plaguing our people that we need to talk about. And so today our topic is going to focus on other STDs or STIs, that means sexually transmitted infections, that are very common in our communities. And so we will talk about gonorrhea today. So gonorrhea, I'm sure every adult has heard about gonorrhea. Is the second most common sexually transmitted infection in the United States, and you have about 1.5 million cases every year. And what is surprising actually is that more than 50% of these cases you also see in the young populations from the ages of 14 to 24 years. And so that kind of falls in within our high school and college kids and young adults. So what is it? What is gonorrhea? How do we get this? So this is a medical class, so bring out your pens and your papers and you're going to take notes.
Hi, I'm Christy. Thanks for following Medical Class 901 with Dr. Chi, Infectious Disease Specialist. Alongside the Shelby County Health Department, we're sounding the alarm in response to an increase in HIV and other STD cases in our community. The Shelby County Health Department is encouraging people to get tested. This comes after health officials say the county is experiencing a peak in a 6-year trend of increasing HIV and syphilis infections. The most impacted group is those between the ages of 14 and 35. According to data from the Tennessee Department of Health, HIV rates in Shelby County have increased 36% since 2018. Syphilis rates have increased by 100%. This is not funny, and it is devastating to know that Memphis is ranked number 2 in the nation for HIV infections among young people like me. We can no longer believe that this is a gay disease. I am a heterosexual young woman, and my status is positive. Please practice safe intimacy and get tested.
What is the prevalence in our community? You know, people just don't talk about it like they did before medicines, came on the scene.
So we have a major issue at the moment. So Memphis, our dear city, ranks number 2 in the entire country for the most newly diagnosed cases of HIV. And what is shocking is that it's affecting our younger populations, our teenagers from the range of 14 years old to 19 up until 21 years old. So it is scary and it is devastating.
Okay, 14 years old. So where is this coming from? Because the only way, in my generation, we always connected it with, intimacy.
Absolutely.
So how are 14-year-olds in that age group contracting HIV?
Exactly. So we all wonder about that. But what this is telling us, obviously, because the numbers don't lie, is that our younger ones are having what we call unprotected sexual intercourse. Okay. I mean, there are many ways you can, pick up HIV. Number one would be through intimacy, unprotected sexual intercourse. You can have other sources like blood transfusion, but these days blood products undergo very rigorous testing before they are transfused. And then you have what we call like vertical transmission, where a mother who has HIV that was uncontrolled and gives birth to a baby and can transmit that infection to the baby. Then for the healthcare workers, you can have like what we call the needle stick injuries, where you get a needle stick from maybe an infected person. And then another population would be our intravenous drug users. So if you're sharing needles, or people that perhaps have to take, let's say, insulin or whatever, and you're sharing needles with people. So those would be the major ways of transmitting HIV. But in our teenage population here, it's pointing more towards unprotected sexual intercourse.
the HIV epidemic in Shelby County.
Memphis actually ranks number 2 in terms of new HIV infections.
Cases well above the national average.
The case rate among 15 to 19-year-olds is 4 times higher than the national average.
And health officials say it's not just the numbers that are concerning, but the lack of prevention and education.
I am Dr. Chinelo Animalu, Infectious Disease and HIV Specialist. We've talked so much about HIV because this is something that is becoming so rampant in our country. Our show is going to focus mainly on prevention, and we're going to talk about PrEP and PEP in the HIV world.
Thanks for watching the Medical Class 901 with Dr. Chi MD, an infectious disease specialist and professor of medicine in Memphis, Tennessee.